Welcome to this guide on mastering USMLE Step 2. This crucial exam is a milestone in your journey to becoming a licensed physician. Passing Step 2 demonstrates your clinical knowledge and skills. Your performance shapes your medical career path. It assesses your ability to apply medical knowledge for patient care. A high score is crucial for licensure and residency selection. Let's embark on this journey together and pave the way for your success. Before we dive into the example questions, let's take a moment to understand the structure of Step 2. The exam is divided into two parts: clinical knowledge, CK, and clinical skills, CS. The clinical knowledge component assesses your ability to apply medical knowledge and understanding of clinical science essential for patient care. The clinical skills component evaluates your ability to gather information from patients and perform physical examinations. This video will primarily focus on the clinical knowledge part of the exam. A 55-year-old male presents to the emergency room with complaints of passing dark, tarry stools for the past 2 days. He reports feeling lightheaded and fatigued. On examination, he is tachycardic and hypotensive. His abdomen is soft and non-tender. What is the most likely diagnosis? A. Hemorrhoids. B. Anal fissure. C. Diverticulosis. D. Peptic ulcer disease. E. Inflammatory bowel disease. The correct answer is peptic ulcer disease. Here's why. The patient presents with classic symptoms of upper gastrointestinal bleeding, melena, lightheadedness, fatigue, tachycardia, and hypotension. These symptoms suggest a more significant bleed, making less serious causes like hemorrhoids or anal fissures unlikely. Peptic ulcer disease, characterized by ulcers in the lining of the stomach or duodenum, is a common cause of upper GI bleeding. While diverticulosis and inflammatory bowel disease can cause GI bleeding, they typically present with hematochezia rather than melena, and the patient's age and lack of abdominal pain make these diagnoses less likely. A 28-year-old female with a history of asthma presents to the emergency room with shortness of breath and wheezing. Her respiratory rate is 30 breaths per minute, and she exhibits intercostal retractions. What is the most appropriate initial step in management? A. Administer oral antibiotics. B. Perform a chest X-ray. C. Start intravenous fluids. D. Administer inhaled bronchodilators. E. Order a pulmonary function test. The correct answer is administer inhaled bronchodilators. Here's the rationale. The patient presents with classic symptoms of an acute asthma exacerbation, shortness of breath, wheezing, tachypnea, and intercostal retractions. Inhaled bronchodilators, such as albuterol, are the first-line treatment for acute asthma exacerbations. They work by relaxing the smooth muscles of the airways, improving airflow, and reducing symptoms. While other options might be considered later in management, the priority in this acute setting is to address the airway obstruction promptly using bronchodilators. A 35-year-old female presents with weight loss, palpitations, heat intolerance, and tremors. On examination, she has a diffusely enlarged thyroid gland. Laboratory tests reveal elevated levels of T3 and T4 hormones and low TSH levels. What is the most likely diagnosis? A. Hashimoto's thyroiditis. B. Graves' disease. C. Toxic nodular goiter. D. Subacute thyroiditis. E. Thyroid cancer. The correct answer is B. Graves' disease. Let's break down why. The patient's clinical presentation of weight loss, palpitations, heat intolerance, and tremors, along with the finding of a diffusely enlarged thyroid, points towards hyperthyroidism. The laboratory findings of elevated T3 and T4 hormones with suppressed TSH confirm the diagnosis of hyperthyroidism. Among the answer choices, Graves' disease, an autoimmune disorder, is the most common cause of hyperthyroidism. It leads to the production of antibodies that stimulate the thyroid gland, resulting in excessive hormone production. A 10-year-old child presents with fever, joint pain migrating from one joint to another, and a new heart murmur. The parents report a recent history of sore throat. What is the most likely diagnosis? A. Kawasaki disease. B. Juvenile idiopathic arthritis. C. Rheumatic fever. D. Lyme disease. E. Viral myocarditis. The correct answer is C. Rheumatic fever. Here's the explanation. The child presents with classic symptoms of rheumatic fever, including fever, migratory polyarthritis, carditis, and a history of a preceding streptococcal infection, like a sore throat. Rheumatic fever is an inflammatory disease that can develop after an untreated or inadequately treated group A streptococcal infection, such as strep throat. The other options are less likely given the specific combination of symptoms and the history of sore throat. A concerned mother brings her 18-month-old child to the pediatrician because the child is not yet walking independently. The child can sit unsupported, pull to stand, and cruise along furniture. The correct answer is to reassure the mother that this is within the normal range of development. Children develop at their own pace, and the normal range for independent walking is wide. A 52-year-old African-American male with hypertension presents for a follow-up. Despite taking hydrochlorothiazide, his blood pressure is 150/95 mmHg. What is the next step in management? Add a calcium channel blocker to hydrochlorothiazide. The patient has stage 2 hypertension, needing intensified therapy. Calcium channel blockers are effective with thiazide diuretics for hypertension. A 25-year-old woman presents with a 3-day history of an itchy red rash on her trunk. The rash consists of small, fluid-filled blisters arranged in a linear pattern. She reports no recent travel or unusual exposures. What is the most likely diagnosis? A. Atopic dermatitis. B. Contact dermatitis. C. Scabies. D. Herpes zoster. E. Psoriasis. The correct answer is D. Herpes zoster. Here's why. The patient's presentation of an itchy red rash with fluid-filled blisters arranged in a linear pattern is characteristic of herpes zoster, also known as shingles. Herpes zoster is caused by the varicella zoster virus, the same virus that causes chickenpox. After a chickenpox infection, the virus can lie dormant in the body and reactivate later in life, causing shingles. The unilateral distribution of the rash along a dermatome, a specific area of skin supplied by a single spinal nerve, is a key feature of herpes zoster. A 30-year-old female presents to the emergency room with sudden onset of severe right lower quadrant abdominal pain. She has a fever of 101 degrees Fahrenheit or 38.3 degrees Celsius, nausea, and vomiting. On examination, she has rebound tenderness and guarding in the right lower quadrant. What is the most likely diagnosis? A. Appendicitis. B. Pelvic inflammatory disease. C. Ectopic pregnancy. D. Ovarian torsion. E. Kidney stone. The correct answer is A. Appendicitis. Let's analyze the reasoning. The patient's clinical presentation of sudden onset severe right lower quadrant pain, fever, nausea, vomiting, and peritoneal signs, such as rebound tenderness and guarding, strongly suggests acute appendicitis. Appendicitis is an inflammation of the appendix, a small finger-like pouch that extends from the colon. If left untreated, it can rupture, leading to serious complications. While other conditions can cause right lower quadrant pain, the combination of symptoms and examination findings makes appendicitis the most likely diagnosis. A 22-year-old college student presents to the Student Health Center with complaints of feeling overwhelmed, anxious, and unable to concentrate on his studies for the past few months. He reports difficulty sleeping, loss of appetite, and feelings of hopelessness. He has withdrawn from social activities and has lost interest in hobbies he used to enjoy. What is the most likely diagnosis? A. Generalized anxiety disorder. B. Adjustment disorder. C. Major depressive disorder. D. Panic disorder. E. Social anxiety disorder. The correct answer is C. Major depressive disorder. Here's the explanation. The student's symptoms of feeling overwhelmed, anxious, unable to concentrate, difficulty sleeping, loss of appetite, feelings of hopelessness, social withdrawal, and loss of interest in hobbies are all consistent with a diagnosis of major depressive disorder. Major depressive disorder is a mood disorder characterized by persistent sadness, loss of interest or pleasure in activities, and other symptoms that interfere with daily life. While anxiety is a component of the student's presentation, the constellation of symptoms aligns more closely with major depressive disorder. A 28-year-old woman in her third trimester of pregnancy presents with a headache, blurry vision, and swelling in her hands and face. Her blood pressure is 160/110 millimeters of mercury. What is the most concerning potential complication? A. Gestational diabetes. B. Preterm labor. C. Preeclampsia. D. Placenta previa. E. Urinary tract infection. The correct answer is C. Preeclampsia. Here's why. The patient's symptoms of headache, blurry vision, swelling, edema, and significantly elevated blood pressure, 160/110 millimeters of mercury, in the third trimester of pregnancy are red flags for preeclampsia. Preeclampsia is a serious pregnancy complication characterized by high blood pressure and proteinuria. protein in the urine, after 20 weeks of gestation. If left untreated, preeclampsia can lead to seizures, eclampsia, stroke, organ damage, and even death for both mother and baby. A 65-year-old male with a history of hypertension, hyperlipidemia, and smoking presents to the emergency room with sudden onset of crushing chest pain radiating to his left arm. He describes the pain as a pressure or tightness that started about 30 minutes ago and has persisted. He also reports shortness of breath, diaphoresis, excessive sweating, and nausea. What is the most likely diagnosis? A. Stable angina. B. Acute pericarditis. C. Pulmonary embolism. D. Aortic dissection. E. Acute myocardial infarction. The correct answer is E. Acute myocardial infarction. Here's why. The patient's presentation of sudden onset crushing chest pain radiating to the left arm, described as pressure or tightness, along with associated symptoms like shortness of breath, diaphoresis, and nausea, strongly suggests an acute myocardial infarction, heart attack. The patient's risk factors, including hypertension, hyperlipidemia, and smoking, further increase the likelihood of an acute coronary syndrome. While other conditions can cause chest pain, the combination of symptoms, risk factors, and the classic nature of the pain make acute myocardial infarction the most likely diagnosis in this scenario. A 5-year-old child is brought to the pediatrician with a fever and a rash that started on the face and spread to the trunk and extremities. The rash consists of small, pink, slightly raised spots that blanch with pressure. The child has also been complaining of a sore throat and runny nose for the past few days. What is the most likely diagnosis? A. Measles, rubeola, B. Rubella, German measles, C. varicella, chickenpox, D. roseola infantum, E. scarlet fever. The correct answer is B. Rubella, German measles. Here's the explanation. The child's presentation of a characteristic rash that started on the face and spread to the trunk and extremities, along with a prodrome of fever, sore throat, and runny nose, is consistent with rubella, German measles. The rash in rubella typically consists of small, pink, slightly raised spots that blanch with pressure, as described in the scenario. While other conditions can cause a rash, the combination of symptoms, the characteristic appearance of the rash, and the typical progression of the illness make rubella the most likely diagnosis. A 35-year-old woman presents to the emergency room with a severe, throbbing headache and a fever of 103 degrees Fahrenheit, which is 39.4 degrees Celsius. She describes the headache as the worst headache of her life and reports that it came on suddenly. She also has a stiff neck and is sensitive to light. What is the most likely diagnosis? A. Migraine headache. B. Tension headache. C. Cluster headache. D. Meningitis. E. Sinusitis. The correct answer is D. Meningitis. Let's break down why. The patient's presentation of a sudden onset severe throbbing headache described as the worst headache of her life, high fever, stiff neck, and photophobia, which is sensitivity to light, strongly suggests meningitis and inflammation of the meninges, the membranes surrounding the brain and spinal cord. Meningitis is a medical emergency that requires prompt diagnosis and treatment. While other conditions can cause headaches, the combination of symptoms and their severity, particularly the stiff neck and photophobia, makes meningitis the most likely diagnosis. A 40-year-old male presents to his primary care physician with complaints of recurrent episodes of burning pain in his chest that worsen after meals, especially spicy foods. He also reports a sour taste in his mouth and occasional difficulty swallowing. What is the most likely diagnosis? A. Gastroesophageal reflux disease, GERD. B. Peptic ulcer disease. C. Cholecystitis. D. Pancreatitis. E. Esophageal cancer. The correct answer is A. Gastroesophageal reflux disease, GERD. Here's the explanation. The patient's presentation of recurrent burning chest pain, or heartburn, that worsens after meals, especially spicy foods, along with a sour taste in the mouth and occasional difficulty swallowing, is characteristic of gastroesophageal reflux disease, GERD. GERD occurs when stomach acid frequently flows back into the esophagus, irritating the lining and causing the observed symptoms. Lifestyle modifications and medications that reduce acid production are the mainstay of treatment for GERD. A 30-year-old female presents with complaints of frequent painful urination and blood in her urine for the past 2 days. She also reports lower abdominal pain and a constant urge to urinate. She denies any fever or chills. What is the most likely diagnosis? A. Pyelonephritis. B. Urinary tract infection, UTI. C. Kidney stone. D. Interstitial cystitis. E. Vaginitis. The correct answer is B. Urinary tract infection, UTI. Here's why. The patient's symptoms of frequent painful urination, also known as dysuria, blood in the urine or hematuria, lower abdominal pain, and urinary urgency are highly suggestive of a urinary tract infection, UTI. UTIs are common, especially in women, and occur when bacteria enter the urinary tract, leading to inflammation and infection. The absence of fever and chills suggests a lower UTI or cystitis rather than pyelonephritis, which typically presents with systemic symptoms. A 68-year-old male with a history of hypertension and diabetes presents to the emergency room with sudden onset of weakness on the right side of his body and difficulty speaking. His wife reports that he was having breakfast when he suddenly dropped his fork and slumped in his chair. On examination, he has right-sided hemiparesis or weakness and expressive aphasia or difficulty speaking. What is the most likely diagnosis? A. Transient ischemic attack, TIA. B. Ischemic stroke. C. Hemorrhagic stroke. D. Bell's palsy. E. Seizure. The correct answer is B. Ischemic stroke. Here's the reasoning. The patient's presentation of sudden onset focal neurological deficits, including right-sided hemiparesis and expressive aphasia, strongly suggests a stroke. The specific combination of symptoms, particularly the sudden onset and the involvement of both motor and language areas, points towards an ischemic stroke affecting the left hemisphere of the brain. Ischemic strokes occur when a blood clot blocks an artery supplying blood to the brain, depriving brain tissue of oxygen and nutrients. A 3-year-old child is brought to the emergency room with a high-pitched, barking cough, hoarseness, and difficulty breathing. The child's parents report that the symptoms started suddenly in the middle of the night. On examination, the child is sitting upright, leaning forward, and appears anxious. What is the most likely diagnosis? A. Croup. B. Epiglottitis. C. Bronchiolitis. D. Asthma. E. Foreign body aspiration. The correct answer is A. Croup. Let's analyze why. The child's presentation of a sudden onset barking cough, hoarseness, difficulty breathing, and the characteristic steeple sign on X-ray, which shows narrowing of the trachea, are classic for croup. Croup, also known as laryngotracheobronchitis, is a common viral respiratory infection that causes inflammation and swelling of the larynx and trachea. The typical age range for croup is 6 months to 3 years, and it often presents with a sudden onset of symptoms, especially at night. A 25-year-old female presents with complaints of excessive thirst, frequent urination, and unexplained weight loss over the past few weeks. She also reports fatigue, blurred vision, and recurrent yeast infections. What is the most likely diagnosis? A. Type 1 diabetes mellitus. B. Type 2 diabetes mellitus. C. Diabetes insipidus. D. Hypothyroidism. E. Cushing's syndrome. The correct answer is A. Type 1 diabetes mellitus. Here's the explanation. The patient's presentation of classic symptoms, including polyuria, polydipsia, polyphagia, and unexplained weight loss, strongly suggests diabetes mellitus. The additional symptoms of fatigue, blurred vision, and recurrent yeast infections further support the diagnosis of diabetes, particularly type 1 diabetes. Type 1 diabetes is an autoimmune disorder in which the body's immune system attacks and destroys the insulin-producing beta cells in the pancreas, leading to insulin deficiency. A 45-year-old female presents with pain and stiffness in her hands and wrists that is worse in the morning and improves with activity. She also reports fatigue and occasional low-grade fever. On examination, she has tenderness and swelling in several of her metacarpophalangeal and proximal interphalangeal joints. What is the most likely diagnosis? A. Osteoarthritis. B. Rheumatoid arthritis. C. Gout. D. Psoriatic arthritis. E. Fibromyalgia. The correct answer is B. Rheumatoid arthritis. Here's why. The patient's presentation of pain, stiffness, and swelling in multiple small joints, particularly the MCP and PIP joints, which are worse in the morning and improve with activity, is characteristic of rheumatoid arthritis. RA is a chronic autoimmune disorder that primarily affects the joints, causing inflammation, pain, stiffness, and eventually joint damage. The additional symptoms of fatigue and low-grade fever are also consistent with RA, which can have systemic manifestations. Throughout this video, we've navigated through challenging USMLE Step 2 practice questions, delving into clinical reasoning and arriving at the most likely diagnoses. Remember, Step 2 is about applying your knowledge to real-world clinical scenarios. We've explored various medical disciplines and encountered diverse symptoms. By analyzing medical histories, physical exams, and lab results, we've honed our diagnostic skills. Recognizing symptom patterns is crucial. For instance, fever, stiff neck, and altered mental status suggest meningitis. Continue creating mental frameworks linking symptoms to diagnoses. This will enhance your clinical understanding and exam readiness. Let's delve into strategies for effective clinical reasoning. Step 2 assesses your ability to think critically and solve clinical problems. One strategy is the hypothetico-deductive method. Formulate potential diagnoses based on the patient's presentation. Rule in or out each hypothesis with additional information. Focus on red flags or alarm symptoms. These suggest serious or life-threatening conditions. For example, sudden chest pain radiating to the left arm suggests a heart attack. A severe headache described as the worst of my life suggests a subarachnoid hemorrhage. Consider the patient's age, gender, medical history, and social factors. These influence the likelihood of certain diagnoses. Incorporate these strategies into your study plan. You'll be well prepared for the USMLE Step 2 exam. Practice with exam-style questions is crucial for solidifying knowledge and refining test-taking skills. It's like training for a marathon. You need consistent practice. Use high-quality resources with detailed explanations. These questions mimic the actual exam, helping you assess strengths and weaknesses, simulate real exam conditions, set a timer, and avoid distractions. Understand the rationale behind each answer choice. Approach practice questions as active learning for exam success. As we conclude this comprehensive guide on mastering USMLE Step 2, remember that success in this exam is a testament to your dedication, perseverance, and unwavering commitment to becoming a skilled and compassionate physician. The journey may be challenging, but the rewards are immeasurable. Throughout your preparation, embrace a growth mindset, viewing challenges as opportunities for learning and growth. Celebrate your progress and acknowledge your accomplishments along the way. Remember, the USMLE Step 2 exam is not just a hurdle to overcome, but a stepping stone on your path to a fulfilling and impactful medical career. By embracing the knowledge, skills, and strategies outlined in this video, you'll be well equipped to excel on exam day and embark on the next chapter of your medical journey with confidence. Best of luck with your preparation. Remember, your hard work and dedication will pave the way to your success.